Hello, so this is Mission Monday. This message, I'm going to be doing a series of messages just to keep people engaged and understanding where we're at with the many things that we're doing. Spine specialist robotic laser decompression, laser current neuropathy therapy, our weight loss program that's beginning, in addition to all the other regular things we do. Our mission, this is a pretty easy message for me. The mission has always been to help patients, help people with things in ways that other people aren't doing. That's the reason I first got into chiropractic. And then I saw things within my profession that I wanted to improve as well. That's where we came up with the robotic laser spinal decompression. That's why we came up with laser current neuropathy therapy. The weight loss stuff also is we're embarking on because people need changes that they're not getting with the regular stuff that everybody else is doing, thinking inside the box. We're trying to do a lot more thinking outside of the box. And anyone who's known me, I've always been kind of a out of the box type of guy. If everybody's going this way, I'm going that way. Maybe it's because I'm an only child and I like being alone sometimes. But I like being alone in effort, alone in what I'm doing to be an individual and show that I'm different and find ways of doing things that are different. So, cutting to the chase, this weekend I was in Ottawa at my daughter's Karate Nationals, Canadian Karate Nationals. She will be going to Worlds, so pretty cool. But I was meeting with Dr. John Zalanka in our program and for robotic laser decompression, and he showed me the x-rays of two patients that had enterolesthesis, which is the bone slipping forward, one bone slipping forward on another. Two of them that were completely resolved with robotic laser spinal decompression. Now, for the chiropractors watching, health professionals watching, they'll be saying the same thing I thought. That's impossible. How do we get a bone that slipped like this? How do we get it to locate forward and stay there? Well, there's actually a mechanism to that. If you driving your car and your tires are very low in air, what happens when a tire is full? It stays on the road nicely. It doesn't wobble back and forth. When a tire is deflated, the car feels wobbly because there's more of the soft tire to slide back and forth like this, if you can sort of get what I'm saying with the hands here. So if the tire's pumped up, the car's nice and solid. If the tire's low, it gets to wobble back and forth. It's exactly what happens with a disc. A disc isn't inflated with air, it's got fluid inside it. If it's pumped up nicely, it's nice and tight and it doesn't wobble back and forth. If it's lost disc space and been deflated or dehydrated, it can flop back and forth. So what this has done, the exact method that this has happened to fix these enterolesthesis. And just so you know, what can happen is if you have the spinal cord here and two bones, bone, one slips forward, look what it's doing. It's running into the spinal cord, it's compressing the area where the spinal cord should be going through, creating pain, creating tension. So if we can pump the disc back up again and rehydrate it and reinflate, then when you take an x-ray of that patient, no longer will the disc be deflated and over here, bones over here, it'll be reinflated and everything will be exactly where it's supposed to be. This is actually the first evidence on x-ray that I've ever seen from any decompression table, and I've done a lot. And I'm not just saying it because it's my baby, but this weekend, seeing those films just reconfirmed my why. If patients can get out of pain and regenerate discs, I mean, this is what it amounts to. To a certain degree, it has regenerated a disc that has lost its hydration. It has rehydrated disc. For years, decompression tables have been saying that they do that. The mechanism is very possible, but I've never seen it happen. The reason I believe that it's happening with this is the laser. Laser increases circulation. It opens up, makes all the tissue more permeable. So if you're trying to suck water into a disc where everything is, there's no circulation there, there's no water, there's no circulation to come into the disc. If you open it all up with laser, soften everything out so you can get to stretch more. It's kind of like a sponge when you drop it into water, how it inflates. If there's water around it, it'll suck the water in and grow bigger. If there's no water around it, then it's not going to do that. With the laser, we're increasing the circulation to the area, we're softening and relaxing it. So not only is there more water around there to suck into the disc, the areas with all the circulation are opening up, so it can actually suck more water into the disc easier, because it's also not being fought by the muscles, so you get more of a stretch. If you were to stretch it here, you can only inflate it that much. If you can stretch it to here, it can suck that much more fluid into it. Now, these are the mechanisms by which I believe this has worked. And it's 2 patients I saw this weekend, and he says he's got a bunch more. So these are some of the things that reaffirm my why we're doing what we're doing, and why we need to do it for tens of thousands, hundreds of thousands of patients around the world. This is what they need. So if you're a patient watching this that needs the help, we'll do our best to try to figure out how to help you with either one of our clinics, if we're in the vicinity of where you are, or helping you find something that might be similar closer to where you are. Before long, we're hoping to have accessible clinics everywhere, which is what we're working on. If you're a doctor that wants to offer this amazing type of care to people, and wants to even talk to me about how it might fit into your system, we have a couple different ways to do it, and ways that fit pretty much everybody's level of comfort with a fully supported new service with robotic laser spinal decompression. So that is our why. That is our Monday mission, to get more people helped with what it is that we do so uniquely and so well. Thank you so much for watching, and I look forward to talking to you soon.